first off, I want to welcome you guys back. This will be a second episode of what we've been going through here. Our first one is posted. It's up on our YouTube channel. So if you guys want to go into the National Allergy and Injury Clinic on YouTube, you can take a good look at that one. That one covered a lot of things. We'll actually be going through a little bit of that with the stomach acid today, and because today we're going to be talking about B vitamins. This is one thing that's been coming up quite a bit. Obviously, as patients come in, we go through the basics. Stomach acid's in the basics. B vitamins are in the basics. So I want to go through these kind of in a little bit more in depth and explain what they do, how they're going to present to you, and then another one, how you can either get a little more or have them work for you in the correct way. So, all right, I'm going to pass this over to you, Doc, on this one. So when we kind of talk about B vitamins, what do they do for us, I guess, is a good way to start. What B vitamins can do?
A good thing that B vitamins do is what they do is they help with brain function, nervous system. Mm-hmm. So they also help with cell reproduction, so it's actually repairing cells. And then it also helps with energy production. Mm-hmm. So if you're not getting enough energy, you feel fatigued, some of those symptoms that will come up, it could be your B vitamins. Now there's several B vitamins that are involved. A lot of us know B6, B12 are the most famous ones, but it starts with B1, B2, and they have special names for them as well, but they're very important to us, and it helps with all our cell function, heart problems, brain function, nervous system. So those are some of the issues that a lot of patients have in this office this time.
Absolutely. Yeah, there's one, and I think that kind of the one that we see with B vitamins that kind of goes a little bit further, and just on our sheet here kind of talks about the things with nerve impulses. So you're talking about a lot of things that are going in with the brain. That's usually, if we kind of talk about it, we adjust the atlas quite a bit.
Absolutely.
First time when patients come in, it's like, well, hey, if we got patients experiencing brain fog, that's another add to it, and we adjust the atlas, and then we look into the B vitamins. Well, if you don't got those, again, those synapse centers that the brain kind of has to go through, they're not there. So that's an awesome point you bring up there, Doc. So what can deficiencies, I guess, so we talk about this quite a bit, obviously, between ourselves, but when we talk about a vitamin B deficiency, what kind of are we looking into? What kind of, what things will you notice kind of going with that?
Well, a couple of things that you can notice pretty quickly is one is fatigue. Fatigue will present itself, wondering why I'm eating properly, I'm exercising, but I just feel fatigued all the time. And it might be because you're not absorbing the B complex or the B vitamins in your digestive system. So you're not getting that nutrients to kind of help with the adrenal glands and with the adrenaline to kind of boost up that energy and stuff. So fatigue is one of the main factors. Another one, like you brought up, brain fog. Yeah. Some people just feel like, man, I'm just having a difficult time in thinking. Yeah. Now, when we also think with the brain, we can also have things that show up like anxiety and depression. So those are some things that we help supplement to help curve that with a lot of our patients. We've got a great product here in the office, and also when you talked about some of the things that we do in the office are basics, those are the NAAT treatments that we do here in the office, the allergy treatments. So B vitamin is one of the first 5 ones that we do. It's that important. Yeah. And we need to make sure that those are done. Also, you can have some hair loss, and you can also have some heart problems. Yeah. So those are some of the main characteristics that we can have as far as symptoms with the B vitamins.
Awesome. Yeah, I was kind of thinking back a couple years ago when I was going in to take, end of the boards season, kind of going and doing that. I think it was RNA I was put on, kind of helps with memory, kind of helps with things that has a lot of B complex to it. So again, there's a lot of different things. Now, on our list here, we've kind of went through some of the foods that are really helpful with B complex. So if we look at those, whole grains are going to be full of them. Legumes, fruits, vegetables, meats, eggs, dairy products, things like that have a lot of B vitamins that are going to carry those. And again, really, we always talk about with our patients, kind of the big overall ones, well, it's for energy. Yeah. It's for cellular energy. It's for our, basic energies that we have throughout the day. There's a lot of things going on with this one. So on the next part of our sheet, Doc, talk about these B6 I know is something that is very crucial.
Yeah.
What is it? Because I know we have, you even mentioned it earlier when there's, B1, 2, 3, you got 6, you got 9, you got 12, there's a lot of B vitamins. What is kind of B6 in particular?
So B6, what it does, it helps with the nervous system and it goes right through the neurotransmitters. So when we are thinking, let's just think about a process of a thought. It passes from cell to cell. Those are called neurotransmitters in our brain and also throughout our nervous system.
Mm-hmm.
So if we have, say, numbness in our limbs, down to our fingertips and our toes, that also is presenting itself because of B6.
Right.
So B6 also helps with the transmission of the nervous system to work properly. So if you're getting like sciatic pain and you're getting that nerve sensation going down the leg and all the way down to the foot, sometimes it could be because of B6. You are lacking B6. So sciatic pain is something that we deal with, almost every day here in this office with the amount of patients that we have. Somebody usually comes in every day with sciatic pain, correct, Doc?
Absolutely.
Yeah, so we're dealing with that, and what we do is we want to take the pressure off the nerve with the adjustments and the muscle work, but then sometimes we need to give them supplementation for that B6
Absolutely.
to help repair because they've had it for a long time.
Yeah.
Now they need that repair for that B6. So that's a really good nerve one.
Yeah.
And we use that also for brain function, which is that depression. We have what they call niacinamide B6, and that has B6 in it. Pretty impactful. I had a patient just the other day said, man, that was a great one for depression because she felt depressed when she left. She took the pill within 2 hours on her way home. The depression was gone. She couldn't believe it.
Yeah.
So she says that this is a really good one for that. So that's one of our highlights that we have right now.
Absolutely.
Working with that.
Yeah, absolutely. Well, and I love that you bring that up. When we adjust, you're really trying to give that quick, that movement to get the pressure off the nerve. But it is, something that nerve hasn't maybe had what it's needed for. People have this for years.
Yeah.
Think about, and even talking to our audience here, how many times have you had, sciatic-like problems? These can be years. I know, in particular, I've had a lot of that, leg pain where it would go numb, early on. Obviously with adjustments and then starting to take in some of this stuff, it's like we can actually repair that a little bit and kind of help out with that. Now, I want to jump down a little bit. I love this little part right here. Pressure damage on the sciatic nerve has always been a common cause and explanation for sciatic pain. So we've already talked about that pressure. It says, however, vitamin deficiencies such as B12, vitamin D, and magnesium play a key role in sciatic pain relief. If you've tried stretches, painkillers, or even therapy and found little to no relief, this could be the answer. So again, we're kind of talking about different things because, again, in our last episode, we talked about going to Google and kind of, what's on the internet. These are cool things because, hey, if it's telling you, hey, take these things, doing different things, why isn't this helping or why ain't I getting the results? Well, it could be because you have a deficiency within the body. Maybe it's vitamin B, maybe it's magnesium. There's a lot of things that could be there. But that is the cool thing about this office is we can actually go in and find what you're deficient in and kind of make a game plan there.
Absolutely.
So
And, looking at that aspect, we're trying to look at the body as the whole body.
Yeah.
Instead of just doing one part of it, we have very many aspects of what we do in the office. We're working with the nutritional aspect. We're looking at the muscle aspect. We're looking at the adjustments. And then we're looking at the chemistry, which is the NAAT treatment that we do to kind of make sure that all these things are functioning in the body. Also, if you're not absorbing what you need to in the body, you could have a lack, like we talked about last week, that stomach acid. That stomach acid is not breaking down into the amino acids small enough for B vitamins to be absorbed. You could be taking these foods, but you're not absorbing them. That's what we look at, making sure that that's working as well.
Yeah, no, that's I think one of those things that, kind of looking through our list. I know we mentioned fatigue, but I was like, mouth ulcers, different things. Now we talked about, I think with muscle weakness, it makes a little bit more sense. You think about these things. It's going to give you energy if it's going to give you the nutrition you need. Obviously, it's going to affect your muscles and things like that. So I really think, now that's awesome. Now, I looked at the very bottom with our shortness of breath topic we had there. Now, we talk a lot about a supplement that I know we've had a lot of patients use has been B-Core, and kind of using that. Kind of helping with heart, heart strength. It really helps because, again, your heart is a muscle. So these are a
Correct.
lot of the things that kind of go into it. So if you're kind of, if you got somebody who, say they are, they're watching this and they're like, man, how do I know if I'm deficient? Maybe they're like, man, I am fatigued all the time, or yeah, I was thinking about this, man, I do feel like muscle weakness. What's a plan for them? What would you suggest, Doc? Trying to get these, patients or, people that are watching, what is kind of your immediate thought as far as, hey, how could we get them maybe less fatigued, a
Right.
little bit more energy? What are some things you think we could do kind of going with that?
So one thing we'd look at is we'd look at making sure that your adrenal glands are working. That's one of the big key factors. Making sure you're not sensitive to the adrenaline inside your body. There are some people, it sounds a little odd, that are not used to what we do here.
Yeah.
But we've been doing it for 20 plus years here in the office, and making sure that the adrenaline is working. That helps with that fatigue. Now, also that B vitamin, that B12, it also helps with repair of your white blood cells. So if you're not getting the white blood cells to kind of help with infections or other problems, if you're having a sore that's taken a long time to heal, there's a possibility that you need some of that B vitamin stuff.
Absolutely.
So that's one thing you look at. Also, if you feel like you're frail, where you're breaking bones and stuff, B-Core is also another one to kind of help with that repair of that body as well.
That's super good. Yeah, no, we've seen a lot of awesome results from patients that have, and again, we talk about this quite a bit. I think the word, medication and supplement, I know a little bit from, my past background with it. They've kind of been linked together at times.
Yeah.
And really what we want to explain is when we're talking supplementation, we're talking all natural stuff that we're getting from fruits, vegetables, meats,
Right.
different things like that. So we're not talking about, something that's maybe been chemically altered. We're not dealing with any of that. With our stuff, obviously being chiropractors, that would make a lot of sense, us being on that side. I think one thing from our sheet that I know I struggled with, that once I came to the realization this could have been what was going on, it really helped. But I know I had a lot of headaches and migraines. And that's another thing that mine truly was. I started taking the supplements that had B vitamins in them. And it almost immediately, obviously, the more I was getting adjusted, the more we were taking tension off the nervous system.
Yeah.
It was helping a ton. But we've seen a lot of patients, as soon as they'll get headaches, they'll get in, say they're coming in for a week, every day for a week. Sorry, not every day for a week. Every week for a month. As they start coming in for that, man, I notice my headaches are going away for 3 or 4 days, and then they'll come back, or I'll have this.
Right.
That kind of goes back to, getting those B vitamins helps repair your nervous system. It's going to also help repair your brain.
Right.
So that was just been awesome with it. Talk about a little bit of this one. I think it does go in a little bit into the depression side of it. We talked about irritability and indigestion. So one kind of, the reason why I link these together is because, what we're feeding ourselves, it does have a huge effect on our brain.
Oh,
So
absolutely.
kind of link those two together, if you would, Doc, for us.
So as far as with the brain and the gut, what we got to do is we got to absorb the B vitamins. So in order for that to happen, we have to have the nutrients, okay? And so if we're eating crap and that crap just kind of builds up, we're not getting that B vitamin, because B vitamin is in a lot of stuff, and because it's so important, they fortify B vitamin in our flour, in our wheat, and various things don't have a lot of B vitamins in it.
Right.
So you want to eat that properly, but the more you eat the good stuff, the more that B vitamin can help.
Yeah.
And if we're not, if we're eating just crap, and if we're just eating fast foods and some of that other stuff, we're not getting what we need. And you're going to have lack of energy just because of the crap we're eating.
That's right.
Okay, so you got to have a well-balanced meal, and you got to have those fruits and vegetables, and get some legumes in there, and we need that meat, Poultry is a really good one for B vitamins, so get some of that stuff in, and that will help with that irritable bowel syndrome that people have, also with the colitis that you hear about. So those are some of the issues that they have with that. So we need to make sure that we get a proper meal, in, so our body can actually repair. And that's the part of that process.
Absolutely. Yeah, no, just as I'm listening to you talk, just that the thought comes to me, as we're talking about, fuel in the system. A lot of, we want to look for a rather kind of quick answer or something else out of that. But really it comes down to, our body can really take care of itself if we give it the right things it needs to take care of itself. So we hope you guys really enjoyed talking about B vitamins today, and we hope you guys understand, why they're so important, why they're in their basic kits, why we treat that first, why it's treated alone, and the importance of it. If you do have any questions, again, you can reach out to us, directly through the comments, through our stuff on Instagram, Facebook, or YouTube. Feel free to reach out. But if you have any questions on this, feel free, and we'll go from there. But our next one will be sending out a post here, kind of talking about our next video that'll be coming up. So that's B vitamins for you guys, and thanks for watching.